Hi, my name is Fata Sise. Thank you for watching. Today I am going to talk about caring for someone you suspect have COVID or is exhibiting symptoms such as that of COVID in a home setting. And chances are a lot of a lot of people are going to be dealing with that because we have well over 500,000 people in Wisconsin who are family caregivers. So at some point, the way this is spreading, at some point, chances are people are going to be dealing with this at home who are not professional caregivers. Today I'm just going to talk about the sanitary part of it, and then I will make a separate video to give you other care details, but the sanitary part of that is so important for the transmission to be able to contain, so you're not transmitting to yourself and not just in case the other person actually get it, so it's not spreading to people. Okay, so gloves. I mean, we all know about the hand washing and, all of those stuff that we've been talking about since this COVID thing started. So hand washing is a big, big, big part of it, which I know most people will probably do their best to do it right. Where my most worry is gloves, how you take off gloves. Obviously you should have gloves. Now that we know how to make homemade masks, you should have that too. If you don't have one in the store, they're hard to come by these days, so make one of your own at home. Having gown is a good thing if you can have it. If you can't have it, just stick to maybe scrubs, so you're actually like wearing something consistently. You're not wearing clothes here and there and having them laid out in different places. That's another thing. So when it comes to gloves, I think the most important part is how you take it off, because you want to take off gloves in a way that it's not contaminated, it's not cross-contaminated. I watched my son bring in our garbage can to the garage from the car, and then he did it with gloves, and then he was taking his gloves off, and I looked at him and I'm like, you cannot take off gloves that way. So it's a reminder that people whose job is actually not putting gloves on, taking it off frequently, as caregivers and all healthcare workers understand this, but people who are actually in the home settings and don't do this often don't know how to properly take off gloves. So you want to make sure that you're taking gloves out and not touching the skin, and both of the gloves. So when you take it out, make sure you don't touch your skin. And then when you successfully take it out, the inside of the gloves should be the one that you see that you touch, your hands actually touch, and you go and dispose it in a trash can or garbage bag or whatever. Now when you take your gloves off successfully, don't just assume that you did that well so your hands are not contaminated. Still, just go right away and wash your hands. Wash like you should for like 20 seconds that is recommended, and also make sure all parts, up, bottom, sides, scrub nails, everywhere. Just make sure you really wash your hands good after that, after using the gloves or doing other things. The other thing is that as far as sanitary goes, you make sure your nails. Okay, so I know you're thinking you have beautiful long and polished nails. Yeah, they look great, but they are sheltered for germs. And what we do not want is having to harbor those germs. We want to take them off. So take off those, especially artificial nails that you put on, those long ones. This is not the time for those. We are gonna get real about this. So cut your nails short. Again, professional caregivers understand this, but in the home setting, everything is so laid back. Everything is more like, in fact, most family caregivers don't see themselves as family caregivers. They don't see themselves as caregivers, period. They just think they're doing what they're doing, but they're not caregivers. So put a caregiver mindset on and do what caregivers need to do so you can be successful at this, okay? So cut your nails, wash your hands frequently. As far as laundry, when you move the person, and again, I will come to the care part of it, but I'm gonna address the sanitary part of it right now. So when you do the laundry of the individual that you suspect have COVID, please move, roll all of the clothes that individual use, and again, you have to use gloves when you're doing this. Put it in like a trash bag to transport it to the laundry machine, so you can just dump it in there and get the trash bag, throw that in the big trash can, or however you want to do that, dispose it. Use disinfectants to clean doorknobs and surfaces and all the other places that needs to be clean. Wipe your electronics like cell phone, because you're touching those all the time, so make sure you're disinfecting those also. So as far as the cleaning goes, those are the basics that you need to keep in mind to ensure that you are doing all of those things in the right way, and ensuring, as far as the face mask goes, that you're wearing it, but the person who's also infected or potentially infected also have a face mask on. So those are the cleaning aspect of it. I'll mention one more thing. Years and years ago, I worked with a very sweet family, and the client was in the hospital, so I went in there, and we were the client had surgery and then was recovering, and we were in there. So the daughter came in, was helping out, no gloves, no precautions or anything. The mom, who's a healthcare professional, who's a client, was like, no, you can't do that. And I fully remember the daughter saying, I am part of you, or something of that sort. So it's like, those precautions don't matter or something. Your germ is my germ. Okay. That doesn't apply here, okay? These are different times. Times are very unprecedented. I get that notion and I respect it. I understand where she's coming from. It's out of love. It's wanting to make your mom feel good in a way. But no, not with COVID, please, okay? So do all the precautions, even if you're used to doing this, but we're not doing it then, do it now, okay? So watch out for my next video. I'll be talking about details of care aspect of it. So tune in another time. Thank you. Remember to keep washing your hands, and we are all in this together. Thank you.